Hi, it's Dr. Sandy Laura Cremers. I'm one of the surgeons of Visionary Eye Doctors. Thank you for joining me today for the EYE show. Today is episode 29. We're going to talk today about dementia and cataract surgery. And so we all have people that we know, many of us have people that we know that have been affected with dementia. It affects about 50 million people worldwide, and we do not have a cure. It is very frightening for many people to think of their loved one not being able to remember their name or be able to remember the conversation they had just a couple minutes ago. We have had many patients that have come to our office, of course, with dementia, and it can be very frightening because they will be sometimes very upset that you didn't explain everything properly 2 minutes later. So you'll go through everything and then get very angry that you didn't explain everything, not realizing that they have dementia or they don't realize they have dementia. So it's something that's very important for us to kind of help patients improve cognitively their memory, their ability to think as much as we can. And many thousands of people are working on finding a cure, finding a way to help patients. So what does this have to do with cataract surgery? So whenever a patient starts to have difficulty seeing, there is a concern, of course, that could affect your ability to think and remember. And it has been shown now, patients that have cataracts, the dementia can progress. So there was a recent study published in JAMA, the Journal of American Medical Association Internal Medicine, in February 2022, which looked at this question better probably than most papers have. It had about 3,039 patients, looked over a series of 5 to 10 years to see if cataract surgery improved the cognitive decline or the mental decline of patients with dementia. And what it showed is that it did help to have cataract surgery on the early side compared to not having cataract surgery. There was actually a 39% decrease in dementia scores in patients that had cataract surgery. So if you're thinking about your loved one and you know they have a cataract, we want to try to improve their vision as much as possible. And what that means is better than 20/40 vision at all times, especially with glare. If you're driving at nighttime or if your loved one is in the car at nighttime with you or whatever it may be, or they're starting to drive at nighttime and still don't realize they have dementia or so forth, then you want to try to think about doing cataract surgery sooner rather than later. And it seems to be this is a long-term benefit. This includes every sense. So if they're having hearing issues, of course, vision issues, we know that's probably true, but this is a good study to show that you want to think about that cataract surgery sooner rather than later. In terms of implants, that's where it gets a little tricky. We don't have great data to say what's the best implant for dementia patients. There have been papers saying that they should have multifocal or kind of a depth of vision lens that gives you more distance so they don't need glasses. There have been papers saying that monofocal, the one that's covered by insurance, is the best. What we need is long-term perspective, ideally double-blind, some type of studies to see what's the best for our patients that have dementia. But it looks like cataract surgery early on is a good idea. That the implants is something that you're going to want to talk about with your doctor, your surgeon, to see what they think is their experience. I have had experience with many types of patients. Most patients do very well with a multifocal or what's called a panoptics implant because they're not needing to necessarily find their glasses, which they lose anyway. So they're able to have better vision for many depths of layers of vision. But there is some concern by some that if you change the environment of the vision with a wrong implant, maybe that might affect their long-term cognitive dysfunction. But we don't have data to prove either one of these concerns. So we're trying to figure out what's the best for each particular patient. So if you have any issues with your loved one, talk it over with a surgeon, talk about what they like to do during the day, if they're really just watching TV, if they're just reading books, if they're just kind of vegging out. That'll determine what kind of implant, how healthy they are, what's their lifestyle, are they still playing golf or tennis, are they still getting out, what are their activities. That will help determine what's the best timing for the cataract surgery and what's the best implant. With any cataract surgery on any patient, especially patients with dementia, the risks are always the same. Risks of needing glasses, even if you have one of the best implants in the world. Risk of needing another surgery, risk of infection. I tell patients, your death is a risk, my death is a risk during the surgery, very rare. Those are risks. With patients that have early dementia or dementia, there's always the risk of cognitive decline with any procedure, even a dental procedure, even a chalazion excision, because any change in their kind of atmosphere, for some patients can be very distressing, and that can lead to cognitive issues in terms of dementia and other cognitive issues for other patients with any mental illness or mental issue. So that's what we think about dementia with cataract surgery, it's always important, as always, to find a very good surgeon who understands patients with dementia. In our practice, we do see patients where we will ask if we can videotape them and have it sent to them and their loved ones, so they will remember the visit. The loved ones can follow the visit. The loved ones, when the patient says, well, can I go back and see Dr. Cremers? And the loved one says, you just saw her this morning. You can show the video and say, you see, remember this visit? You saw her. Remember she answered all your questions. Remember she talked about this. We see this very frequently. We used to have a patient who we dearly loved who would come in every single day to see me because he had dementia and he was living still alone, and his daughter was living far away. So that's how this all started, because we started videotaping him. We got permission, which, as you know, is with dementia patients, we're not sure what they understand. But when he would come in, my team and I would show him the video and say, look, you were just here earlier this morning, or you were here yesterday, and we went through everything. And that would calm him down. So he'd say, okay, I had my questions answered, because he wouldn't remember. So think about that. Work with your surgeon. Talk about this option to help your loved one help understand that this is a procedure that is generally very safe. It takes usually about 10-15 minutes. Most patients do very well, even those with dementia, and they all go on to really sometimes improve, according to this recent study, their cognitive function. So I hope this video was helpful. Please, as always, subscribe to our channel and pass this on to people. Subscribe to our podcast, and I can't wait to see you next week. Thank you.